Andrea, and I'm doing my presentation on anterior glenohumeral instability. What that is a laxity of the anterior stabilizing structures. The main factors it's due to are middle glenohumeral ligament laxity and the laxity of the anterior band of the inferior glenohumeral ligament. And the ligament can also be avulsed from the labrum, which is a big heart lesion, and can create instability as well. Other factors which aren't as important to instability are rotator cuff weakness or tears, dysfunction of the long head of the biceps, and superior glenohumeral ligament laxity. The main mechanism of injury is excess external rotation into abduction, so like this. As Dave was saying, chronic, it can be chronic, which is due to repetitive microtrauma, such as a baseball pitcher who constantly throws all day, every day. Acute is dislocation or subluxation. Again, Bankart lesion and Hill-Sachs lesion can be an acute mechanism. Predisposing factor is hypermobility, excuse me. So increased movement in the joint capsule. Signs and symptoms: decreased active, passive, and resisted range of motion and external rotation due to pain and instability. Pain with palpation over the anterior joint capsule. Atrophy of the deltoid, rotator cuff, and scapular muscles is possible in chronic cases due to misuse of the capsule or the musculature surrounding it. And increased anterior glide is also possible compared bilaterally as long as the other side doesn't have instability as well. So you have to make sure you ask and yeah. For the evaluation, most tests are designed to recreate the sensation of instability or pain. So the apprehension or crank test, the shoulder is at 90, so 90 degrees of shoulder abduction and external or elbow flexion. And then it can be done standing, sitting, or supine. And a positive test is muscle guarding when you push posteriorly on the arm. Relocation test is done supine. Again, the shoulder and arm is at 90, and you provide a posterior force on the humeral head and press posteriorly. And a positive sign would be reduced pain, because you're providing that stability on the anterior capsule. And then the anterior release or surprise test is done the same way, except you remove the your hand from the humeral head, and so it's like a surprise. And that's the most accurate test from one of the articles I read. And then treatment, there's conservative treatment. Rotator cuff strengthening is a big thing. You want to strengthen all the muscles that are attaching to the capsule. And surgical is also an option. Arthroscopic stabilization is the main one that I found. And another article said that you can do corticosteroid injections to reduce pain and inflammation.